So thank you for having me. My name is Dr. Megan McElheran. I'm a clinical psychologist practicing in Calgary, Alberta, Canada, and am very excited to have been given the opportunity to come and chat with you folks today, particularly about some of the work that we're doing that relates to Stoicism and in our practice. My work, I actually did my graduate training in the U.S., so kind of started my career working with military members and veterans of the U.S. military, and have continued to do so in Canada, basically since I came back here in 2007. So all of my work is in the realm of public safety, and I continue to work with active duty military and veterans and police officers and so on. And I'm going to talk today about an approach that we have started to adopt, particularly relative to training with our Canadian public safety members, that is really kind of scrutinizing the construct of Stoicism as it's been kind of applied, at least in our Canadian samples and circumstances. So my talk today is going to be introducing a model that we've been working with here in Canada called functional disconnection. And as you can see by the title of my slide, what we're really going to be looking at is this notion of the so-called kind of stiff upper lip Stoicism, and really presenting the functional disconnection reconnection model as an alternative to that approach, particularly in our public safety population. So I thought I would just begin a little bit, obviously for those of you who wouldn't be familiar with the Canadian context, I just want to give a little bit of background an introduction to operational stress injuries in Canadian public service or public safety, because it's been particularly relevant in terms of the work and in terms of the model of functional disconnection and reconnection we're going to talk about today. Because our population up here in Canada is different from the U.S., certainly in terms of number and scope and conflicts, etc., that we've been engaged in. And so when the war in Iraq and Afghanistan began, Canada's involvement in Afghanistan represented our first engagement in sort of a mass-scale conflict since World War II. And so, our system, our mental health system, our care system for military members has been much, much different and somewhat underdeveloped until Afghanistan came along. And, in the sort of midst of the conflict and in the post-Afghanistan world, as there were Canadian soldiers returning home, what was being found was that there were typically 25% or more of returning soldiers were being diagnosed with post-traumatic stress disorder. And so in our Veterans Affairs and our military system up here in and around 2004, the notion of sort of reterming or relabeling psychological conditions like post-traumatic stress disorder as operational stress injuries was proposed, because there was this real understanding that if you have this high degree of diagnosis and psychological injury that soldiers were presenting with, it probably had more to do with the service that they had given versus sort of something internal or individual to each military member. So really, we've been talking about operational stress injury and post-traumatic stress disorder in public safety quite significantly since about 2004, 2006, which again, is not that much time when you think of kind of the scope of military service, etc. But it's only been fairly recently that we have started to really kind of dive into and understand this particular issue in our Canadian serving members. And so, from basically 2004 onwards, the federal government here in Canada and beyond were starting to initiate and institute different and new mental health programs for Canadian soldiers, and particularly developed a series of clinics across the country that were developed specifically for Canadian military members, veterans, and then members of our federal police force. And what that started to do was, again, sort of bring to light the significant psychological risk that a lot of our public safety members were facing in the context of doing their jobs and in the context of their operational service. And when the military began to do this, what ended up occurring was that this started to be increasingly understood for other uniformed service personnel. And so by 2011 in Canada, what we were finding is that sort of our workers' compensation system. So basically, this is the system that allows people to receive income support if they're unable to work because of being injured on the job. What started to happen in 2011 and beyond was that provincial workers' compensation organizations were recognizing that certain uniformed service members had greater risk of psychological injury or operational stress injury. And so there started to be what's called presumptive PTSD legislation being put into place in all of the Canadian provinces. And what that means is that if you were a police officer or a paramedic or a firefighter or a corrections officer or a dispatch officer, communications officer, and you developed symptoms of post-traumatic stress disorder, it would be presumed that those symptoms were developed in direct relation to your operational service. There were many intentions and reasons why this occurred and why this was important. But one of the things that it did was it started to and continued to destigmatize uniformed service personnel reaching out for the help that they needed. And so whether we looked at Canadian military samples or Canadian military populations, or we looked at members of other uniformed services across Canada, what we started to see significantly from 2011 onwards was that people were coming forward more and more and more, reaching out for help and really needing to understand what was happening for them, psychologically speaking, and really trying to connect with people who could help them in reducing symptoms and increasing or improving their functioning. Because what we found up until that point was that your typical military member or uniformed service member would sort of be hiding in the shadows, suffering with symptoms, but not feeling as though there was going to be support or acceptance if he or she were to come forward and describe the struggle that was being had. So we had a population of people that was increasingly starting to reach out for help. What we also had was a population of people who were significantly struggling with symptoms of PTSD and depression, anxiety, and other disabling psychiatric or psychological conditions. Okay, and so in my work and in the work that I have done with other sort of stakeholder partners across the country, one of the things that started to be explored in and around 2011, 2012 was what's going on, right? Why are we seeing these really, really high rates of operational stress injury and post-traumatic stress disorder significantly in our uniformed service personnel, right? There was a need to sort of understand what was leading to this chronicity and to these disabling conditions that people were developing, because if we could understand some of what was contributing to it, perhaps there could be more from a sort of prevention or intervention standpoint that could help people not become as disabled or as functionally impaired by the conditions that they might have developed. And so certainly, right, I mean, in military populations and police populations, it's understood that there is just a far greater and far higher rate of exposure to potentially traumatic events and stressful operational and organizational circumstances, certainly. So we absolutely understand that. And there seemed to be other things that were going on that were, again, contributing to these high rates of injury that were starting to be seen and understood in these populations. And some of the factors that came to be understood related significantly to operational or organizational culture. And so one of the things, there's other factors, but that's beyond the scope of the talk today. One of the things that started to emerge was this real understanding that in public safety contexts across the country and across the course of history in Canada, there really had been this established norm or this established culture around Stoicism. Right, and this notion that to be a masterful and a competent public safety member, whether that was of the military or police or fire or what have you, to be able to be sort of seen as competent and effective in your job, you needed to be able to demonstrate a stoicism over the work that you were doing and these sort of emotional and physical and cognitive impacts the work was having on you as an individual public safety member. And so Stoicism, as it's been applied up to this point in Canadian context, has really meant being able to basically keep a lid on emotional experience and have, be able to demonstrate this so-called mastery over thoughts and emotions and the ability to sort of disengage from any of the emotional vulnerability that might come along with the work, and that was seen as a sign of competence and frankly seen as something to aspire to if you were a new member into the occupation. that, Stoicism equaled not being affected by the work. And, there's lots of sort of commentary and narrative and anecdotal evidence that goes along with this notion that, this is the job, right? If you're a cop or you're a firefighter or soldier, whatever, this is what you signed up for. And so, there's no time for you to be, feeling frightened or saddened or disgusted or whatever sort of, flavor of vulnerability might show up. The sort of interpretation of Stoic values and Stoic philosophy up until, kind of this recent point in history has been vulnerability equals weakness, and vulnerability is manifested as demonstrating an emotional reaction to the work that you're doing in public safety. And so, I got really interested in this a number of years ago because, it seemed to me to be a really losing proposition that, what we should be trying to encourage our public safety members to do is learn to sort of suppress or deny or minimize the very natural emotional and psychological reactions they might have to the traumatic nature of their work. And that it seemed a bit strange to me that, we were maybe encouraging our public safety members to engage in this sort of stiff upper lip stoicism and kind of these suppressive and minimizing kinds of tactics, when at the same time we were, recognizing that there were these incredibly high rates of psychological injury that people were coming forward with, people going off work because of disabling psychiatric conditions at rates we had never seen before, so on and so forth. So there really seemed to be something awry with that particular equation. And as I said, in my research efforts, I got particularly interested in this around 2015, 2016, and have continued to be moving forward. And, I'm not going to do a deep dive into Stoic philosophy here because obviously, you folks as the audience are going to know some things about this. And really what I sort of think is most important for the purposes of what we're going to continue to talk about is this, kind of this awareness or this idea that, I guess my proposition or hypothesis is that unfortunately we seem to have misinterpreted some of what the Stoic values and Stoic philosophy was intended to be about. And that, rather than kind of teaching people or encouraging people that they should divorce themselves from their emotional or cognitive or physical reactions, particularly in the face of traumatic events, there might be a different sort of approach or a different kind of training and skill set that an individual public safety member might need to do the work as effectively as possible. And that sort of stiff upper lip, let's just separate ourselves from it or detach from it, that may not be the most effective or frankly healthy equation or solution for folks moving forward. So one of the things that we looked at was, could we put together some type of a training program for public safety members that would introduce them to psychological concepts and teach them about psychological principles in a more sort of proactive and front-end kind of a way, so that in the dissemination of their jobs, fire, paramedics, police, what have you, there could be a place in, the active sort of dissemination, the critical incidents that folks might be attending, that there could be a place to teach folks where they needed to be able to sort of contain and potentially, detach to a degree from what they were experiencing and feeling and thinking in the moment that they were actually at that event, right? And we've talked lots with our public safety members up here about that, and of course that makes sense, that when you're at a car crash or a fire or something, that's not the time to sort of be able to, be introspective and reflect on what you're thinking and feeling. However, what we started to look at was, kind of leaving people with only that sort of stoic, stiff upper lipped kind of approach seemed to be, complicit or contributing to these high rates of injury. And so therefore, we needed to consider, was there an add-on, was there an addition to just that sort of containment and that detached approach that we could teach people to employ in the service of their work, and could we study that and see if it's, if it would have an effect on people's mental health overall. So I'm just going to give you a really brief introduction to the program that we developed. It's called the Before Operational Stress Program, and it was developed in partnership with Wounded Warriors Canada, which is a charitable organization here in Canada that serves our military members and public safety members and their families. And then in addition, we have our research partners out of the Canadian Institute for Public Safety Research and Treatment. So this program, the BOSS program, was developed and it started to be disseminated. Started to be disseminated in 2018. here in Canada. So far, it's only been disseminated with Canadian populations, though we have some plans and intentions to take this south of the border, in the fairly near future. And the idea here is that we're actually providing the groups of participants who are coming into the BOSS program with specific education and information and experiences relative to managing operational stressors differently than how they've historically been trained. So, the program generally, just kind of give you a highlight or highlighted overview, is comprised of 8 modules, each of which are 2 hours each. And the intention in the BOSS program is to bring groups together, up to 10 to 12 people at a time, where they are all from public safety organizations. They might be from the same organization, or there might be mixed organizations who come together. And they're clinically facilitated interventions where we're actually teaching people on the front end, some psychological things about operational stress, and again, some ways in which they can take psychological constructs into their sort of day-to-day self-care routines while they're doing their work of public safety. Okay, and specifically, I want to focus on in the BOSS program, we have each module that builds kind of the one on the next, and I want to specifically focus on what we talk about in module 1 and then what we finish with in module 8. Okay, and module 1 is so important because we spend a lot of time with the people who are in these groups talking about Stoicism and talking about how, Stoic values may have been misinterpreted relevant to or relative to how the Canadian public safety members have learned to do their jobs. And so we spend quite a bit of time talking about, what members have learned in their public safety organizations about emotional expression, emotional processing, how you process and work through the critical and oftentimes traumatic events that happen at work. And, not surprisingly, heard a consistent narrative that, the only thing that people were sort of encouraged to do or told to do, even sometimes flat out, was really to keep it to themselves, or, potentially to find solace in a bottle at the end of a particularly difficult shift or investigation, but that was about it. And in module 1, we have this conversation and we talk about, Stoic philosophy and the Stoic philosophers, and really consider, was this, what we're talking about in the lived experience of these individual public safety members? Do we think this is actually what was being sort of conceptualized or encouraged by, Marcus Aurelius and, the other Stoic philosophers, and really come to a place of going, maybe not. Maybe there's something about this degree of sort of emotional suppression and stiff upper lip and minimization. Maybe that there's something about this as a global approach that's actually been pretty problematic for psychological health of public safety personnel. So that kind of nicely sets us up. We start talking about Stoicism. We give some, references to some books, and we encourage our members to start reading about these. And it sets us up to go on a bit of a journey over the next 7 weeks, where we start to look at, what are the effects on the brain and its functioning? What's the effect on stress and stress dysregulation? What are the effects cognitively, emotionally, behaviorally, and from a communication standpoint? If we only sort of have this sort of suppressive or minimization kind of an approach to dealing with or coping with operational stress. And it gives, our members an opportunity to really kind of consider this and explore, what this approach has been like for the individual person, and also to start considering what might be some alternate and potentially more effective ways of coping with operational stressors when sort of that stiff upper lip approach isn't the only thing that people have to draw on. And so, where we begin in session 1 is to really say, maybe this approach was misinterpreted. Maybe it's contextually inappropriate, right? Maybe we are asking our contemporary public safety members to do things, differently and in different ways than, public safety of ancient civilization might have expected. And so, where and maybe what we need to consider is that there's a different model or a different construct that's required to support public safety members, again, from a psychological perspective, to continue to do their jobs, which are, of course, very, very important, but do them in a way that actually gives them more flexibility and more sort of emotional or psychological approaches to the work, other than, again, just trying to, act as though it's not happening, or act as though they can be sort of, masterful and tough it out, regardless of how it actually makes them feel. Okay. And so after kind of going through these 7 modules together, and again, we've got we've got groups of 10 to 12 people together for 2 hours at a time for these 7 modules, and then finally we end in our 8th module. And what we've done over the course of the BOSS program up to that point is really establish and set the stage for the proposal of this different construct, which is, as we're calling it, functional disconnection and reconnection. And so this is actually a model that draws from some research done by a Canadian researcher here out of British Columbia. His name is Paul Whitehead. And Dr. Whitehead looked at emergency room physicians and oncologists who were doing obviously very difficult work in terms of providing end-of-life care or providing next-of-kin notifications, so on and so forth. And in his research, he learned from these physicians that what they had to do was really learn how to disconnect, and that they had to go into sort of action mode. And when we learned about Dr. Whitehead's research, this really sounded to me like, pretty consistent to what a lot of our public safety folks do. It's like there's action time, it's go time. You have to sort of set everything else aside and be ready to respond. However, as we've already been talking about today, there seemed to be a piece missing, and that's where we really looked at, is it important and potentially effective to bring in this aspect of reconnection, where we want people to be able to sort of detach and take care of themselves when they need to operate, when they need to do what is required of them in their occupational roles. And in equal measure, we propose that it's just as important for people to learn how to sort of reconnect and sort of develop a process of awareness and ritual, and be very intentional about the reconnection process, which sometimes is being able to just create space for and pay attention to the fact that emotions are happening. There's certain thoughts and body reactions that are happening, and rather than judging or trying to change those things, perhaps there's a place from a Stoic philosophy perspective of being able to just let those things be as they are without sort of adding to potentially suffering by trying to change something from its original state or its original form. Okay, and so I'm just going to put on in the next slide here. This is a graphic that would require a bit of sort of in-depth unpacking to sort of really teach the audience how to use this in an efficient or effective fashion. But I'd just like to draw your attention to this notion that we really are considering sort of functional disconnection and reconnection as an alternative to that sort of stiff upper lip stoicism. And what we're doing in this training program is really trying to teach people the difference from a physical, emotional, mental, behavioral, and spiritual meaning of the self in our context, really teaching public safety members that there's a different set of skills and an approach, psychologically speaking, that they need to embody or utilize when they're in sort of the functional disconnection kind of phase of the work or dissemination of occupational duty. And then in equal measure, there's this process that needs to be deliberate and intentional about re-engaging from a reconnection standpoint. And that's really paying attention to, just the impacts or the ways that whatever has happened in operational service has actually impacted the person on whatever domain, right? Whether that's a cognitive change or an emotional change or whatever the case may be. And what we're hoping in this is that by, potentially providing an alternate way of looking at how to take care of one's psychological health in the work of public safety, that we're actually going to be hopefully facilitating our public safety members to actually, in a non-stigmatized, non-judgmental kind of a way, be able to hold and have the experiences that they develop related to the duty or the service that they are completing, right? When I think about a military member being deployed and being outside the wire, or a police officer going to a domestic call, or a firefighter going to a sudden death or something like that. We want people to be able to kind of stay psychologically safe as they're engaged in those activities. And then in equal measure, we want to help them to have more ability to process and engage and work through the very natural reactions they would have had to those experiences, right? And not just tell them that it shouldn't bother them and it's what they signed up for, and if they're really competent and masterful, that they should be able to push those things aside. Because again, if we go back to where we started from today, all we're seeing is these skyrocketing and compounding rates of psychological injury in the folks doing that very important work. And so this proposal, this alternative way of looking at how to approach the work that we're calling functional disconnection and reconnection is a different sort of strategy or a different approach that we are proposing. So I just wanted to finish by kind of letting you know a little bit of the status of our research. So as I said, we started disseminating this program to Canadian public safety members in 2018. We've had about 200 participants through the program at this point in time. And we've had enough data sort of collected at this point, or basically we had enough data collected by earlier in the fall that we were able to do some preliminary analysis of, what the data is telling us, what the program is showing in terms of, impact or effectiveness, and particularly, sort of underscoring the fact that we are teaching the participants this functional disconnection, reconnection model and approach. And so at this point in time, so as I said, we've had just over 200 folks participate in the program. So we had enough power in our data to be able to, analyze things relative to statistical significance. Because of our sample size, we still have relatively small effect sizes, which is to be expected. But this is what we found so far. So we do have statistically significant findings. We do have the ability to now sort of identify BOSS as an intervention and as sort of a training intervention that could be considered effective for public safety members, at least, as it pertains to the sample that we've been studying. And our data has shown us that when people have gone through the BOSS program with the material that they've learned across those 8 modules, and in addition to some of the follow-up components that are offered as part of the program, we've had statistically significant reductions in symptoms of post-traumatic stress disorder, in symptoms of depression. We've had reported increases in social support, quality of life, and then reduced stigma overall. We had some non-specific or non-statistically significant effects for reported resiliency. And there's a lot of ways to interpret that. Our first paper on the BOSS program will be is actually just been submitted, so we're hoping that's going to be published in January, as well as the paper on functional disconnection and reconnection is also in the process of being published, so that should be available. Again, we're hoping in January. So I was really excited to come to this talk and to be able to offer up this information. Just as a slightly different sort of approach and way to think about, the Stoic values that have been sort of perpetuated, at least through our Canadian public safety organizations, and to really sort of, hold that interpretation of Stoicism that we seem to have made up to a little bit of scrutiny and see if it really fits with how we want our public safety members to be engaging in their work, understanding the high risk of psychological injury that we are seeing. And so, hopefully what we have, at least right now, our data is promising. It certainly is a small data set, so we're going to keep studying it and keep doing our research. But we're really hopeful and sort of anticipating that what we're providing people in the BOSS program, and particularly this, sort of different way of looking at Stoic philosophy and interpreting Stoic philosophy, in organizational cultures, that this sort of functional disconnection reconnection model may be more consistent, from our perspective with what might have been intended from the Stoic philosophers. And we're hopeful that providing this kind of more flexible approach to doing the work is ultimately going to continue to show benefit in the people who are receiving the intervention. So that's it's a very quick introduction to some of our background and the work that we've been doing. I've put up my email. I'm super happy to connect with people. If you have any interest in what we're doing or want to learn more, have a conversation about it, please don't hesitate to be in contact with me. Shoot me a question if you have them, and we'll go from there. So thanks very much for having me and for your attention and interest in this area.